Thank you, Mr. President, and thank you to my partner, Councilmember Rice, and I mean partner in the black way and the regular way. It was great to work with you on this, and thank you to Linda McMillan, who I will reiterate an email I wrote earlier today, or in the wee hours of the morning. You have done so much on so many issues, and we all appreciate the work that you're doing. I want to thank Pam Luckett on my staff, who worked on her birthday weekend. Her birthday was Sunday, all through in multiple meetings, and the week before on this issue, and as well as Councilmember Rice's staff. This is and also, of course, the African American Health Program, who has been working since the beginning of this crisis. They were one of the first to present to HHS back in March a plan for one of the ideas that is incorporated in this appropriation, these ideas of COVID kits to help for community members. And at that time, we didn't know the full expanse of the crisis, and it was kind of it was too innovative. It was too early for that. And here we are taking some of those issues and others up. So thank you for all the work that they did, the African American Health Program, the Executive Committee, and all their members. Look, we know that African Americans, Black residents, experience worse health outcomes on average more than other groups because of long-term health chronic conditions that are based in a system of racism that we've discussed, that lead to higher rates of diabetes, hypertension, lung conditions, asthma. The data is stark. Black women 4 times more likely to die in pregnancy-related complications than white women. The average life expectancy of African Americans is 4 years lower than the rest of the population. These statistics and many others are why I drafted, and I'm so thankful for all my colleagues supporting, resolution declaring racism a public health emergency for our Black residents, our Latino residents, our communities of color here in Montgomery County. And the action that we had to take for the Latino community last week, and what we're taking, or 2 weeks ago now, we're taking now in the African American community, speaks to why this is such an urgent matter. And I want to thank Council Members Navarro and Albanaz for their partnership and work as well. According to the Washington Post, to Councilmember Rice's point, nearly 1 in 3 Black Americans know someone directly who has died from COVID. Think about that. 1 in 3 Black people know someone who's died, not just contracted, died from COVID. And part of that reason is because Black people, similar to here in Montgomery County, are dying at 2.5 times the rate of white residents. As of July 17th, Black residents were identified as 28.7% of confirmed cases, but 40% of confirmed deaths. It's just devastating when you think about that. The rates, and that's nationally, the rates in Montgomery County tell a similar story. As of July 31st, the rate was 87.3 per 1,000 for non-Hispanic Blacks, as compared to 76.6 for non-Hispanic whites, and 72.1 for the overall county population. And so that's why this is so urgent that we do this and work with the African American Health Program to put this money, again, a start forward. Key component is testing. And while we've continued to ramp up testing, I want to thank Dr. Gales and his team and Dr. Stoddard. There's still a great need within the Black community for increased testing that's both culturally appropriate and linguistically competent. One of the great things we're blessed with here in the county is a very diverse Black community that speaks different languages and comes from different continental Africa and the Caribbean. And so we need that's where some of these, I think this is one of the great things about this, is there's going to be some overlap with the Latino program as far as that component, and we will benefit and share some of those needs as far as testing. But this is also a very comprehensive approach that the African American Health Program put forward, in part of which we're going to have a permanent testing site in East County with pop-up testing available in other places where we have concentrations of our Black community, the distribution of the COVID kits that I mentioned, and the development, something I'm very excited about, and I know Dr. Crowell and Councilmember Rice are, of a Black physician partnership to provide residents who test positive for COVID-19 with financial assistance for copays so that they can follow up with physicians that are going to understand their unique needs. This is something that will lay the foundation for long-term addressing of these health disparities going forward, connecting our Black residents to primary care. And I'm really excited that we're taking this step in the midst of a crisis, but having the forethought to say that we know that we need to address this long term. So I want to thank Councilmember Rice again. I'm really appreciative to all my colleagues, and I think this is a great start in a crisis to address some serious issues. So thank you, Mr. President.